Good evening. Welcome to this press conference. First, I should explain that we are not wearing masks today because we have sufficient safe distancing, and the journalists and reporters are not in this room. They are in their respective offices, and we have also sufficient safe distancing. And what is also important is that so that you can hear us better. So worldwide today, the number of COVID-19 cases have crossed the 1.5 million mark. And as of 12 p.m. today, we have confirmed an additional 287 cases in Singapore, the highest daily tally so far. More than 200 of these cases are related to foreign workers residing in dormitories. This is also partly due to our efforts to step up testing among this group. Director of Medical Services, Associate Professor Kenneth Mak, will provide more details in a short while. Overall, we expect the number of cases to continue to rise in the short term before it stabilizes, because it will take time for the circuit breaker measures to take effect. The circuit breaker measures kicked in about 2 days ago on 7th of April. While the crowd have thinned in town and central business districts, there are still some social gatherings taking place close to people's homes in our heartlands. Some are also not observing safe distancing when they have to go out for essential purposes such as to buy food. More than 10,000 advisories have been issued by our enforcement officers over the last 2 days. This cannot continue. The circuit breaker measures will only be effective if all of us abide by the rules and bear the collective responsibility of keeping one another safe. We will therefore step up enforcement, and we will not hesitate to take action against individuals or companies who flout the measures. Now I would like to ask my DMS, Professor Mak, to give an update on the details of the cases today.
Thank you very much, Minister. As of the 9th of April, 12 noon, we have seen 287 new cases confirmed and diagnosed to have COVID-19 infection. Of these 287 cases, 3 were imported cases, 219 were linked to clusters, 19 were linked to other cases, and 46 cases remained as yet unlinked. Epidemiological investigations and contact tracing continue, and we will continue to establish links as they become evident to us. Of the new cases that were linked to clusters, the majority of them, in fact, were cases linked to the dormitories. Many of these come from the S11 dormitory, and there's at least 160 cases from this particular dormitory. But the number does not reflect necessarily the number that were truly symptomatic. We've, in fact, started active case finding and are swab testing workers in the various blocks in the dormitory. And many of the cases that were test positive in this category were, in fact, workers who have very mild symptoms or were well. Our epidemiological investigations continue, and we have successfully linked several clusters together. And this is with the assistance of the Singapore Police Force as well as MINDEF. Preliminary links have been established between the cluster at the Mustafa department store, the Project Glory construction site, as well as 5 dormitories, and this includes the S11 dormitory, the Tampines dormitory, the Toh Guan dormitory at the Sungai Tengah Lodge, as well as Cochrane Lodge 2. Many of these cases started out, in fact, with a cluster at Mustafa, of which a number of these were employees at Mustafa. And when we believe that workers had visited Mustafa, and they subsequently transmitted infection to their co-workers, either at the Project Glory construction site or to other residents within the dormitories that they lived in. The transmissions most likely occurred through close contact, for example, at meal times, during breaks, but also between co-workers at work due to physical proximity at the work site, and subsequently to colleagues and friends within the dormitories as they engage in social activities. In total, we have 1,910 cases of confirmed and verified COVID-19 infection. of which 884 remain admitted in hospital, and 29 of these cases are in the ICU. We have had 314 cases discharged from acute care, and 705 cases decanted to a community isolation facility or a step-down facility. 7 cases have passed on. Of the cases that were decanted into an isolation facility, the community isolation facility, 108 have completed isolation and returned home. Of those that were, in fact, were looked after within our private hospitals, there was an additional 38 that completed isolation. So in total, 146 cases have completed isolation and have in fact gone home. With regard to the dormitory, we've been working very closely with the Joint Task Force that's led by the Ministry of Manpower, the Singapore Police Force, the Ministry of Defence, Singapore Armed Forces, and we provide the medical support for workers in the dormitories who are ill and fall sick. In the dormitories, which are of concern and which we have identified as isolation areas, we have set up medical posts, and the medical posts have medical personnel who looked after these workers as they present with symptoms. We've also, in addition to the medical posts, performed active case finding, going in to look for workers who are not well, and then, if necessary, to bring them down for further assessment. When we pick up symptomatic workers, we would make every attempt to isolate them and prevent them from then mixing with other workers within the dormitory. We will test them, and if they are tested positive for COVID-19 infection, we will continue to treat them in our hospitals or in our community isolation facility as it becomes available. Those who are not tested positive but remain symptomatic from the infections that they may have, we will keep them separate so as not to also have further any infections spreading to other workers in the dormitory. And as we extend our reach to reach out to all workers in all the dormitories in Singapore, we will continue to establish more medical posts in phases. Thank you.
Thank you. Good evening, everyone. So let me just say a few words on the foreign worker dormitory issue. We've had foreign worker cases before, including cases in dormitories. But this time it's different because there are many more venues outside of the dormitories, as Director of Medical Services said, like Mustafa, like the Project Glory construction site, where the workers had either gathered together or worked together, and that's where the virus had spread amongst them. And then when they went back to their respective dorms, they transmitted it back to their fellow workers in these dormitories. Many had very mild symptoms, and so they continued to work. And that's why there was a delay in picking them up. And so it's very likely that the virus spread had been going around for some time in the dormitories, and we are now seeing all the indicators of it. So when you look at the situation in Singapore, I think it's important to realize and recognize that we are dealing with two separate infections. There's one happening in the foreign worker dormitories where the numbers are rising sharply, and there is another in the general population where the numbers are more stable for now. And that's why we need a different strategy, a dedicated strategy for our foreign worker dormitories, because there is a greater spread of the virus in these dormitories, and there is also higher transmission rates given the large numbers of workers living in close quarters. This is a very major and urgent issue that requires active intervention, and that's why at the task force level we decided to put in more resources and to set up a dedicated task force focusing on the foreign worker dormitory, and we are enlisting resources from the whole of government, including help from the Singapore Armed Forces and the Singapore Police Force. As far as the ministerial task force is concerned, we are also tapping on other people to assist us. The task force at the ministerial level already has DPM Heng as our advisor, but for this particular work in dealing with the foreign worker dormitories, we have invited Senior Minister Teo Chee Hean to help advise and guide us for this piece of work. And given his experience, given that the SAF and the police force are involved in this work, his involvement has been very useful and helpful. What are we doing for foreign worker dormitories? There are two parts to our strategy. First, ensure effective management across all dormitories. And that's where the SAF, the police, are leaning forward, working with the Ministry of Manpower and the dorm operators to put in place proper management across all the dormitories given the current situation. That means taking care of the workers' daily needs and their well-being, because all of them now have to stay in the dorms. So you have to take care of very basic issues like cleanliness, hygiene, their food, delivery to each one of them. And at the same time, making sure that all the safe distancing measures we have put in place are fully complied with, which means ensuring that you minimize the movement of workers and minimize intermingling of workers. So that's the first key strategy, right? Effective management. We cannot rely solely on dorm operators anymore, given the current situation. The government is leaning forward, working with them, ensuring effective management. Second, ensuring effective public health measures are in place. And as Director of Medical Services said, this means deploying medical posts in the dorms, starting with the critical ones, but eventually scaling up to all the dorms, actively screening and testing workers, and then separating those that are infected and the suspect cases from those that are healthy. To do all this well, we will need to reduce the number of workers in each dorm so that the situation is more manageable. So we are moving out workers who are not sick, and we are, especially for those who are in essential services, because they still need to continue to work. So we are moving them out, those that are not sick and in essential services, and we are accommodating them in alternative venues. We have activated a few alternative sites, including SAF military camps, Changi Exhibition Center, that's the one where we organize aerospace, floating hotels. This is typically used for offshore lodge accommodation, so we are activating some flotels, as well as a few vacant HDB blocks. So these will be alternative sites where we can pull out workers that are not sick, that need to continue to work for essential services, and we can pull them out and accommodate them in these alternative venues. And in these alternative sites, we will also ensure sound management and public health measures, as what we are doing in all of the dorms. Essentially, we are sparing no effort to contain the spread of the virus in the foreign worker dormitories. We have a responsibility for these foreign workers who have come all the way here at considerable expense to make a living in Singapore. So we will do our part, and we will do our very best to take care of them and ensure their safety and their well-being. Despite our best efforts at containing the situation, all of us have to be mentally prepared that the numbers in the foreign worker dormitories will continue to rise in the coming days and perhaps even in the coming week or so. This will happen before they start to stabilize. Right? But we do have a comprehensive strategy, and measures are in place, and the agencies are now working round the clock to execute and implement them. And I will let Minister Josephine Teo elaborate on what are some of these specific measures. I've outlined the overall strategy, but she will give you more details. Thank you.
Thank you, everyone, and good evening. Minister Lawrence Wong has outlined two important key thrusts in managing the situation at the foreign workers' dormitories. One part of it has to do with how the dorm management has to change from the current model. The other part of it deals with how we can be effective in the medical management within the dorms. I will expand on what we are doing within the dormitories. The current model of operations has to go through major adjustments. For example, at the dormitories, it was always the practice for the workers to prepare their own meals. This has to come to a stop. In order to protect the workers, in order to reduce the opportunities for them to interact with one another, the human contact, which then raises the risk of transmission, we have to ensure that they are provided with meals instead. So this is one major adjustment that has to be made. The other major adjustment has to do with cleanliness and hygiene in the dormitories. Whereas previously, the workers left the dormitories for the better part of the day and were at their work sites. Now they are spending all their time in the dormitories. What that means is that in terms of the maintenance of the hygiene amenities, as well as the cleanliness management, it is of a completely different order of magnitude, and we have to be able to take care of that too. The other aspect that is also very important in the dorm management is that although all the dorms had dedicated sick bays, now we are talking about scaling them up in order to be able to appropriately take care of those that we need to isolate, whether they are still being going through the period of assessment or afterwards. So those are the three major areas of changes in dorm management that we have to put in place. Now, whereas in the past it was always the dorm operators that took care of these things, I think we have to step in and help the dorm operators, because it is an enormous task to be able to implement these changes in a short time. Now, so that we can effectively enhance the dorm management, we want to be able to stabilize new procedures so that we can then replicate them and sustain these measures. So a stabilize, replicate, and sustain approach has to be adopted. How are we going to do so? We formed an interagency joint task force. This task force has already operationalized itself on Monday. And when this task force was operationalized, one of the immediate tasks that they went about trying to put in place was the formation of what is known as the Forward Assurance Support Teams, FAST, Forward Assurance Support Teams, FAST teams. What are these FAST teams? These FAST teams comprise of officers either from the SAF or the SPF, and supplemented by also MOM officers, each team being 9 persons deployed to work with individual dorm operators. By Tuesday, we had 3 FAST teams already working with the dormitories that were gazetted as isolation areas. By Wednesday, we have been able to put together 43 FAST teams and match them with all the purpose-built dormitories that we have in Singapore. So all of these 43 FAST teams have been put in place, and they have been working round the clock. Now, what are the things that they have been trying to do in this stabilize, replicate, sustain model? The first thing that they have to settle will be the immediate task of making sure that food is delivered in a timely fashion and of a quality that brings sufficient care and comfort to the workers. That is very important, because the primary objective of these FAST teams is to ensure the well-being and the health and safety of these workers. So their first priority was to settle food distribution, needs to be timely, needs to be able to meet the quality that will bring comfort to these workers. We had initial glitches, but I think working round the clock over the last couple of days, this has mostly been resolved. And by now, most of the meals, in fact, can be delivered from the first person to get it to the last person to get it completed within 2 hours. Now, at the same time, the cleanliness and the hygiene have also been stepped up considerably. Whereas previously, the garbage, the rubbish were cleared perhaps once a day, now it has gone to, on average, 3 times. And this depends on the size of the dormitory. At the same time, the cleaning of the toilets, the restrooms, as well as the disinfectation of the rooms themselves, the frequency has also gone up 3 times a day at the minimal. So if you look at the isolation, those that have been gazetted as isolation areas, the dormitories operations now, in terms of the food supply, in terms of the cleanliness and the hygiene, they have improved significantly, and I can say that they have been stabilized. And so when we gazetted the third dormitory, To Guan, as an isolation area, all of the experiences that we gained in S11 and Westlight ensured that for To Guan, the implementation of these new measures were done in a much smoother fashion. So this part of it having been stabilized, now our next set of priorities have to do with 2 main things. One is we will replicate what we have found to work in all the other dormitories that have yet to be designated or gazetted as isolation areas. In other words, the operations will also be brought to the same level, same standards as those that are gazetted as isolation areas. So you will see a consistency of approach across all the purpose-built dormitories. The other important priority now in the next phase is, as Minister Lawrence Wong says, we need to thin out the dormitories, reduce the number of people in each of these dormitories in order that within the dormitories we can have effective safe distancing measures. These safe distancing measures include making sure that all the workers who are still residing in these dormitories adhere strictly to the quarantine requirements, meaning that they stay in their rooms, they only leave their rooms to collect food or to go to the washrooms. So this is really important. We have to get it right. And we are progressively doing so for the 3 isolation area, the dormitories that are gazetted as isolation areas and all the other dormitories progressively. Since Minister Lawrence Wong has already talked about where we are looking for alternative sites to enable some of the workers to move out, I will not belabor the point, but simply to say that it is part of the strategies that we put in place to try and ensure that the health and the well-being of the workers residing in the dorms continue to be maintained, and to the best of our ability, make sure that they keep healthy. We are, of course, also looking at other issues that the workers are themselves concerned with. For example, working with the employers to ensure that they are paid, working to ensure that they will still be able to provide for their families back home through the remittance services that they find very important. So I want to assure you that we're sparing no effort. The multi-agency joint task force is working very hard, and all the dormitories now have the fast teams that are deployed on the ground. We are progressively implementing all of these measures and will ensure that we continue to monitor the health and the well-being of our workers, and if they have any issues, to address them appropriately.
Thank you. Other than our efforts in managing the cases in the dormitories, we also need to continue to put forth our efforts in reducing the risk of transmission within our community. Over the last 2 days, we have received many queries from members of the public on whether they can continue to gather in groups, meet friends, have a meal with friends or with family members. Let me explain. The key message is really stay at home. Go out only for essential activities, such as to buy food or seek urgent medical attention. Not to go and socialize, not to have parties, not to meet each other, not to meet friends. This is very important. And we understand that some may have elderly parents who live alone, and they need to visit them regularly in order to help them with their daily needs. This we will permit, but do try to reduce the interaction times as far as possible and observe strict personal hygiene. This is in order to protect them. And do so, visit them only when necessary and not so frequently, because we do need to protect our seniors. And for the same reason, we will also not allow parents to drop off their children with their grandparents on a daily basis. Because every time when you bring your children to your parents or to their grandparents, we expose them again and again to potential infection. So if there's care arrangement for the grandparents to look after your children, then you should leave the children with your grandparents throughout the entire circuit breaker period. This is to protect the seniors, to minimize the risk of exposure to virus attacks. I understand that some essential workers may have problems with this arrangement because both father and mother have to go out to work and the children have to leave it with their grandparents. If you are able to leave them with childcare services, do so. We have made childcare services available for essential service workers. And if not, there are no alternatives, appeal to us and we will consider on a case-by-case, but only for essential services workers and only when there are no alternatives. This is to ensure minimum exposure for our seniors to this COVID-19 virus. The elderly and are vulnerable and most susceptible to severe COVID-19 infection. We should refrain from exposing them to the risk of infection as far as possible by avoiding frequent contacts. Every time we visit them, we put them at risk. I know these measures are very painful, but they are necessary to protect our seniors. And we'll continue to monitor the situation, and from time to time, we may need to tighten the measures further. And we also need to step up our enforcement to ensure compliance with these social safe distancing measures.
Thank you. So moving on to what we have to do for, remember I said we are dealing with two infections. We've dealt with the foreign worker dormitories, but within the rest of our population, outside of the dormitories, we have the circuit breaker in place. I think if you go out along the streets now, or if you are outside, you can see that there is clearly a visible difference. Many people have complied with the instructions. They are staying at home and going out only for essential activities, and when they go out, many are wearing a mask. We are going to enforce the rules very strictly because there are still, unfortunately, people who are not following the instructions, and there are still some hotspots in Singapore. We know where they are when we are focusing on these hotspots and enforcing the rules very tightly. So we have more than 2,500 enforcement officers now out and about. First offense, they will give you a written warning. Second offense, there will be a composition fine. Third offense, you'll be prosecuted and there may be a jail sentence. So the enforcement agencies are going all out to enforce these rules very strictly, and we hope that Singaporeans will comply not just because of the enforcement efforts that are ongoing, but really out of a real necessity for all of us to do our part and ensure that this circuit breaker truly has an impact in controlling the spread of the virus. Even as we do all this, we are continuing to review the circuit breaker measures that we had put in place, because there are some places which we had allowed originally under the circuit breaker rules, but we are still seeing people gathering in these places. So for example, we had kept stadiums open because we thought this would be an avenue where people going out to exercise could, exercise in these stadiums without bunching together. But yet, unfortunately, we do see groups, people coming in groups to exercise in the stadium, which is not what the intention was, right? So we have decided from henceforth to close stadiums altogether. Because if there is no compliance and if these venues continue to be used for congregation of groups, then we cannot allow that to continue. So we are going to close stadiums altogether. The basic point is this. we are not stopping people from going out to exercise. But if you want to exercise, do it by yourself or do it with a family member that's already living with you, and do it in your own neighborhood. Do not go out to a special place outside, drive, make a special trip just to exercise. Minimize movement, minimize travel. Do what you need to do within your own local neighborhood. Do not exercise in groups, do not jog in groups, do not cycle in groups. Any of that would be any such activities would be an offense. So let's be quite clear once again about what this circuit breaker means. It really requires all of us to minimize movement and stay at home as much as possible, so that we do not become the weakest link that causes another large cluster to emerge. Right? We are already having to deal with a foreign worker dormitory clusters. Let's not have more clusters emerge outside of that in our own community as well. And to do that, all of us really needs to do our part. So we are continuing to enforce and review the rules, and over the coming days, as we monitor movement, we may very well have to tighten up some more, so that the circuit breaker will truly be effective and all the efforts and sacrifices that Singaporeans are making over this coming month will eventually pay off. So if you talk about the alternative venues, they come in different different locations, and they will have different capacities. Military camp, for example, can easily accommodate thousands. Again, it varies. But the key for all of these alternative venues is not just a place to stay, but you need toilets and you need showering facilities, right? So all of these are essentials to ensure the well-being of the workers. So SAF camps have already been activated. Thousands have already moved. Minister Josephine Teo mentioned 5,000, more than 5,000 workers have already moved out, so some in SAF camps. We have a few also in vacated HDB blocks, just a few areas, one in Tanjong Pagar, another one in Jurong. So we have already identified them, and again, workers are already staying there. The total capacity is also in the thousands. A flotel solution is something that is being activated. The first one might be ready in a matter of a few days. That one flotel alone can take maybe 500 workers. These are typically done for offshore and marine workers. Yeah? They provide accommodation for those who are doing offshore work. So the solutions are there, and again, we are bringing them in, and the first one will be activated soon, and then a few more will be activated as well. Right? Then if we go further out, we are also looking at Changi Exhibition Center, the one for the aerospace. That's a large venue. Again, it can easily accommodate thousands, and we are starting to prepare these venues. So it's more than, when we talk about these venues, there's a lot of preparation work involved to get them ready. And importantly, it's not just the venue alone, it's the management that comes along with the venue. No point putting workers there and then there's no management structure, right? So there is a need to do both in parallel. Workers are moved out, alternative venue in place, and then a proper management structure to ensure that the workers' daily needs are attended to ensure their well-being, and also to take all the necessary precautions in all of these venues as well. Meaning to say, if there is, for example, somebody who, should a worker fall sick even in one of these alternative venues, then we want to be able to quickly isolate them and not end up with more clusters in these venues either. Right? So all of these precautions are put in place as part of our foreign worker strategy. Your other question on the circuit breaker, you asked whether masks will be made compulsory. We are, as we had highlighted earlier, we had updated our guidance on masks based on evidence, based on scientific information. And that's why we now advise people, if you're going out, if you cannot avoid close contact, to wear a mask. We will want to make it mandatory in certain circumstances, and so we are already requiring food handlers to wear masks. It's you may not see it now, but that requirement has been put in place, and we are giving some time for the food handlers to adjust, but very soon all of them will be required to wear masks. We are looking at requiring this for food delivery as well. And then again, we are looking at other instances, other circumstances where we may want to make it mandatory. But so again, we are guided by evidence and scientific advice on our overall mask policy. Second, will it be illegal now to, say, drive to a park or a public area far away from where you are staying? Again, I said earlier, our advice is if you go out to exercise, do it within your own neighborhood. We have not prohibited somebody from driving out or going further away, but we will review and we may well have to tighten. Some countries do that. If you look at the impositions of the people movement control and restrictions that some other countries have put in place, they are very specific and they only allow exercise in your own local neighborhood. And if you want to drive out and if you were to do so, then that specific activity is prohibited. So we are reviewing our guidelines and we may well have to tighten if a lot of people are still doing it, because at the end of the day, as we said, the key to success of this circuit breaker is if everyone minimizes movement and stays at home as much as possible.
So I think, let me take this opportunity to share that many people have asked, can I do this, can I do that? I think it's important for us to bear in mind that the key message is really stay at home, minimize contacts, physical contacts, close contacts with people. And if you can't avoid that, wear a mask. And if you really need to exercise, which is important to continue to exercise and have sunlight, minimize the need to travel long distances, because the longer you travel, the risk of close contact with people will increase. So instead of asking whether I can go to a park far away, we should ask whether do we need to do that. If you don't need to go to a park far away, we can exercise near where we stay. Please do so. Minimize close contacts with people, stay at home as much as possible, and exercise as you need to do so.